Yoga and Lifestyle, the theory for 12th standard children. Today, if you are staying at home, hope they join me in live session. Otherwise, they can see it of like during leisure period and the 1 hour which they have for the physical education study hour. So, hello, good morning to all of you. Subscribe, share it with 12th class CBSE and CRT physical education offered children. There are few children who have taken it as a additional subject and few have taken it as a main core. But I will recommend physical education to be taken as an additional subject because maths and science, never think of leaving them. They are useful in every subject, and if you have taken up good marks in 10th standard, kindly see that you take up maths and science. But it's a stress, yes. The thing is, you will have to put full effort, and physical education can be a additional subject, I feel so. And as a core subject, when you take up, you will have to spend time for it. Okay, so we let us discuss about the asanas which are required for to reduce obesity and diabetic, hypertension. So follow me. So this is the earliest video. Part 1 has the asanas to prevent diabetic, Bhujangasan, then Pachimutasan. I have clearly said about Pachimutasan, a long sitting position, and then slowly raise your upper body, breathe in, and then when you're coming down slowly, hold the knee, hold the toes, and then breathe out completely, and this is how you do your Pachimutasan. And now we'll discuss about Pavanamuktasan. The Pavanamuktasan is this is the way we keep our knees. Okay, and it is derived from word Pavan, which means wind, and Mukta means release. So this is the asana for yeah. So for diabetic, okay, those who suffer from diabetic can do these asanas. And how to lie down is, you will have to lie down supine. When you lie down flat facing upward, it is called as supine, and then feet you will have to bend. Okay, both the feet, keeping feet together and arms beside body is the lying down position, and then slowly bring right knee towards chest and press the thigh on abdomen with both the palm like the clasped hands. Then breathe in and lift head and chest off the floor and touch chin to right knee. Hold and take deep long breath in and out. While exhaling, tighten the grip of the hands on the knee, okay, and increase the pressure on the chest. As you inhale, loosen the grip. After exhaling, come back to the ground and relax. Repeat this pose with left leg and then with both the legs together. So this is how you do your Pavanamuktasan. And the benefits are, it strengthens the back and abdominal muscle, tones the muscles in legs and arms. It helps in digestion and release of gas. It enhances blood circulation in the hip and joints and eases tension in the lower back. It helps to recover the effectiveness of the inner organs. Contradiction: avoid practicing this asana if people are facing high blood pressure, heart problem, hyperacidity, hernia, slip disc, neck and back problems. What during the period of pregnancy. Anyone suffering from hernia or piles should avoid this asana. So, Ardha Machendrasana, I described Ardha Machendra asana along with obesity. So, part 1, please check for Ardha Machendrasana. So, the asanas which are needed for to prevent diabetic is Bhujangasan, okay, then Pachimutasan, then Pavanamuktasan and Ardha Machendrasan. Okay, so this is about our diabetic preventing asanas. Now we are going to have for asthma. The major following are the symptoms for asthma: shortness of breath, stiffness in chest and pain, frequent coughing and sneezing, wheezing sounds, increased difficulty in breathing. Asthma is mainly allergy induced. Okay, it may be due to sometime occupational environment can also or dust that can also trigger allergens and can cause asthma. Few suffer from exercise induced asthma. Respiratory infections can also be cause for asthma. Certain medications including beta blockers, aspirin, then ibuprofen and naproxen may cause asthma. Strong emotional situation can also trigger asthma. So, how to prevent and manage asthma is by using air conditioner. That is, the windows of the air conditioned houses are mainly closed, and this reduces the entry of airborne pollens that can cause asthma. Minimize dust in the house and at working place. For example, by removing carpeting and installing hardwood can reduce the dust. Clean regularly. Keep your home and workplace clean. This reduces the dust. Use of mask while cleaning can also prevent asthma. Actually, during this pandemic, we all have started using mask, and using mask in washrooms, I feel more comfortable. So let's make it a practice in future too, even after the pandemic gets over. So symptoms of asthma are coughing, wheezing, discomfort, and then shortness of breath and tight chest. So let's see the airways during asthma issues. Okay, so this is normal airway. Okay, this is a normal airway, relaxed, smooth muscles are here. Can you see this? The muscles are relaxed, and this is a normal airway. But here, when you come, asthmatic airway is this. Okay, how it becomes, though, and then here you can see asthmatic airway during attack. This is during the attack. Wall inflamed and thickened. So can you see the wall inflamed and thickened? Okay, and here you can see air trapped in alveoli. Here, how is the alveoli? Right? So can you check here? And tightened smooth muscle. The muscle is being tightened. The muscles here are relaxed. So here they get tightened. So this is the airway which gets affected and causes asthma due to many reasons. Okay, so we are going to see the asanas now which are being done and which are benefit for us: Sukhasana, Chakrasana, Gomukasana, Parvatasana, then few we discussed already. Pachimutasan we discussed, and then I even discussed about Sukhasana in the previous video. So asthma can be managed by following ways, that is regular exercise can be done, then avoid obesity, eat plenty of fruits and vegetables, control acidity, breathing techniques, and then relaxation techniques. Breathing techniques through pranayama. Okay, so the acid that is by breathing technique practice we reduce our stress. So let's see, already we have seen Sukhasana. Okay, I have told clearly how to sit in the Sukhasana position. um, Crossed legs, and then knees along with folded legs. Okay, knee should be bent and along with the folded legs. And then about chakrasan, here we are having, I will tell you how to do chakrasan. Okay, you'll have to lie down flat on the floor, supine position, and then fold legs and keep it down below knee hip. Make sure that the sole of the foot touches the floor. Bring both hands and keep it beneath the shoulders. Take deep breath and keep hands and legs on the floor. Then slowly raise hips, shoulder, and head from the floor. The fifth step is bend your back as much as possible. Stay on the same posture for a minute. The benefits are it reduces stress and tension. It helps in strengthening the back and increases the elasticity of the spine. It reduces fat in the abdominal area and tones the digestive system. It regulates endocrine gland and maintains the metabolism normally. It helps in stimulating the process of the liver, spleen, and kidney. It helps in relieving asthma, back pain, and migraine. So contraindications are, this is the stick pick. Okay, suffering from diarrhea and hernia should avoid this asana. People having heart problem must do this asana after consulting a doctor. This asana is not safe for pregnant women. People having pain in wrist, ankles, and spine should avoid this asana as it may harm their body parts. Avoid this asana in case of cervical injury. Persons suffering from hypertension must not practice this asana. Okay, so this is about chakrasan. And chakrasan, if you are not able to do chakrasan properly, then you can go for modified chakrasan also. It's called as ardha chakrasan. Okay, so let's see Gomukhasan. Okay, next is Gomukhasan. How are we going to do Gomukhasan? And you're going to just see the Gomukhasan here. Okay, this is Gomukhasan. So what you're doing here is, it is this, the word is taken from Sanskrit, and the meaning is cow. Gomuk means cow, Gau means cow, and Mukha means face. So several parts of the body simultaneously we do it, including ankle, thigh, hip, chest, neck, arms, and hands are being stretched here. So how are we doing it? Slide knees together in front and stacking the right knee directly on top of the left. Sit back in between feet, which should be equidistant from hips. Support weight evenly in the midst of sitting bones. Extend left arm up, then bring left hand down to the center of the back. Reach right arm out to the same slide and parallel to the floor. Then rotate the arm inward. Then thumb will return first towards the floor until palm faces above. Step 6, take a deep breath and while exhaling, sweep right and behind, right arm behind and in the hollow of the lower back. Now, step 7, keeping spine long and hold hands behind back. Then lift left elbow towards upward direction. Then draw right elbow towards the floor. Keep left arm close to head. Now release arms and cross legs and repeat Gomukasan with the left leg on top and left elbow pointing down. So this is the stick pick. Okay. The benefits of Gomukhasan, it relaxes a person, it stretches and tones the muscles, then it stretches and enables this asana enables greater flexibility of the hip joint. It improves the functioning of abdominal organ and digestion. It increases flexibility of the shoulders. It stimulates kidney for better functioning. It is helpful in relieving ailments like diabetic and high blood pressures. It may ease the symptoms of arthritis. Contraindication: this asana should not be practiced in case of neck injury. Avoid this asana if you are suffering from sciatica. Pregnant women should avoid this asana. Don't practice the asana in case of knee injury or shoulder injury. Now let us see Parvatasana, okay, like a mountain. Parvat means mountain and asana means posture. How are we doing here is, firstly sit down on the floor keeping cross leg position. The legs are kept apart a little more than the hip width. Bring hands in front so that palms face down towards the performer. Exhale and move hands overhead. Keep your finger interlocked and hands stretched upwards. Pull torso in upward push direction and stretch it as much as high. Hold this position for a little longer and breathe normally. Come down in original position. Repeat the asana about 8 to 10 times. So this is a stick pick. It helps in reducing mental fatigue and also improves the memory and concentration. It strengthens the weak muscles of the body and thus prevents any injury. It improves the health of internal organ. It helps in reducing the respiratory problem like asthma. It helps in losing body weight. It reduces extra fat in the back and waist. It helps to reduce back pain. It also tones the abdominal muscles. The next should contraindications. The neck should be kept straight to avoid any forward movement. This asana should not be attempted in case of knee pain. Persons having shoulder and hip movement should not attempt this asana. Avoid hunching of the back during sitting position. It can cause hunchback and stiff shoulder due to wrong way of doing this asana. Then the Bhujangas and Pachimutasan are the ones which I have showed in the previous video. You can check that. Now Matsyendrasana, Matsya Asana. Matsya means fish and asana is posture. Is also name of an incarnation of God Vishnu. Lie on the back on the floor with knees bent and feet on the floor on the yoga mat. Okay. Breathe in and lift pelvis slightly off the floor, then slide hands palms down and hip below hips. Okay. So this is the asana which you need to know. I am very sorry, like I am teaching people of school. So I am a teacher of a school. Hope I have a right people on the portal here when I am taking a class. So please do not message me unnecessarily here. Okay, and step 3 is then the rest hips on on the back of your hands and keep okay, keep the same position while this asana is performed. Tuck forearms and elbows up close to the sides of torso. Breathe in and press forearms and elbows firmly against the floor. Then press shoulder blade into back during inhalation. Lift upper torso and head away from the floor. After this release, head back onto the floor depending on how high your arch is, and lift chest back of head must rest. uh, Lift, okay. After this release, uh, release head back onto the floor depending on how high your arch is, and lift chest back of head must rest on the floor. Keep minimal amount of weight on head so that there is not too much pressure on neck. Keep knees bent or straighten legs out onto the floor. Stay in this position for 15 to 30 seconds, breathing smoothly. And step 11 is breathe in and lower torso and head back down to the floor. Benefits: it helps in opening the directs round shoulders, it provides relief from respiratory disorders and increases lung capacity. It helps in strengthening back muscles. It helps tone the pituitary and pineal glands. Practice of this asana brings down stiffness of neck and shoulder. It helps in curing spondylitis. Then contraindication, when we shouldn't do it. A person suffering from hypertension must avoid this. Migraine and insomnia. Insomnia means the one who doesn't get sleep. Patients should also avoid this asana. Individuals suffering from serious lower back or neck injuries should not practice Matsyasana. With heart ailments should not practice. Pregnant women should not attempt this asana. So these are the asanas for to prevent asthma. Okay, you can check this: Sukhasana, Chakrasana, Gomukasana, then Parvatasana, Bhujangasana, Pachimutasan and Matsyasana. So those who have asthma can take care of yourself by doing asanas which I mentioned just now. Hypertension, the asanas are Tadasana, Vajrasana, Pavanamuktasana, Ardha Chakrasana, Bhujangasana and Savasana. So these are the signs and symptoms of hypertension. Okay, you can see this bit closer. I'll come. Low blood pressure. Okay, so these are the symptoms. So hypertension is known as high blood pressure. Healthy lifestyle changes are important for lowering blood pressures. Lifestyle plays an important role in treating your high blood pressure. If blood pressure is controlled by healthy lifestyle, it can avoid, delay or reduce the need of medication. So blood pressure is the pressure your blood exerts against your blood vessels walls as your heart pumps. Blood pressure comes from two physical forces. The heart creates one force as it pumps blood into the arteries and through the circulatory system. The other force comes from the arteries resisting the blood flow. So blood pressure is measured in millimeters of mercury, written as mmHg. For example, normal blood pressure in adults should be less than 120/80 mmHg. Uh, See, I'm discussing about health, and I am really unable to tolerate this. Somebody messages unnecessarily here. So this is about systolic pressure is the higher or top number and represents the pressure at the peak of each heartbeat. Diastolic pressure is the lower or bottom number and represents the pressure when the heart is resting between beats. And then a manometer is the instrument used to measure blood pressure. So, how can we prevent and manage hypertension? Exercise regularly, eating healthy diet, sodium intake should be minimized and it should not be more than 2.300 mg a day. Reduction of saturated fat not more than 6% of daily calories, and total total fat 27% of daily calories. When using fats while cooking, select monosaturated oils such as olive or canola oils. Consume more whole grain and vegetables. So, this is actually the lessons which I am taking is mainly for students. So, people don't. I'll be happy if people do not, those who are not related to this, watch this, because people should value teachers' lessons and subjects related conversations. Okay. So this is consume fresh fruits and vegetables every day. Use nuts, seeds or legumes in daily diet. Consume modest amount of protein, not more than 18% of total daily calories. And then fish, skinless poultry. Okay, consume okay, fish, skinless poultry and soya products are the best protein sources. Then a healthy lifestyle promotes a habit of eating proper diet which can control hypertensions. So proper sleeping habits, that is 8 hours of sleep is must, and when you are in stress you go for late night sleep, and that may increase that may lead to stress hormone level increases with sleeplessness. So proper sleep is must, that is 8 hours of sleep. It constituents of it's a important constituent of a healthy lifestyle and can reduce blood pressure. Reducing stress, a person who practices yoga, relaxation techniques such as meditation may reduce stress. Even playing games can also reduce stress. The reduction in stress can also reduce the hypertension. Reduction in consumption of alcohol. If excessive alcohol is consumed regularly, it can lead to hypertension. The permazile is 148 ml of wine, 335 ml of beer, 45 ml of liquor. Excessive drinking can lead to hypertensions. Avoid tobacco products. It is well known of the fact that cigarette smoking increases blood pressure. So tobacco can raise 10 by Hg of blood pressure. Smoking throughout the day leads to high blood pressure. Avoiding tobacco products can help in controlling hypertensions. So the three factors that may cause fatigue relationship between these are the activities we must do it. Okay, which the activity which I want from you all is three factors that can may cause fatigue relationship between high blood pressure and circulatory system. The reason high blood pressure is called the silent killer. Okay, and the 5 symptoms of high blood pressure. 3 factors that could cause irregular heartbeat. So this is an activity for you all. Okay, so Asanas to prevent hypertension is Tadasana. Then this is the stick pick, and then Ardha Chakrasan. Okay, all these are standing ones. So Tadasana, you will have to keep your body straight. Your posture should be straight. Slowly raise your arm up, and then stretch maximum. Go on toes, and then breathing while raising your legs, and then hands up. Breathe in. Then when you come down, breathe out. And the Ardha Chakrasana is you are going to arch back. Okay, so the best one is Savasana. When you do Savasana, you are almost reducing your stress level. So these are the asanas: Tadasana, mountain pose, then Vajrasana, which I have explained earlier. Pavana Muktasana also I have explained, Ardha Chakrasana, and then Savasana. All these practical sessions I will be showing you very soon. Okay, this is how to reduce back pain. For this also Tadasana, then Ardha Machendrasana, Vakrasan, Salabhasan, Bhujangasan. So these are the asanas to reduce your back pain, and back pain can happen due to non-mechanical disease process, then heavy lifting, trauma, poor sitting posture, frequent bending forward, and then degenerative conditions. So this is the recent causes of low back pain. Okay, according to Dr. Finkel, movement and exercise also keep the spine healthy, flexible and strong. Gentle forms of exercise such as yoga, pilates, water therapy, riding a stationary bike, or walking are especially helpful. Poor postures can lead to back pain. Sedentary lifestyle also can lead to back pain, that is sitting and watching TV for a longer time, or playing in the computer for a longer time can increase your back pain. And poor posture, like you need to keep right and left balanced, otherwise it leads to your back pain. Incorrect lifting style, you need to lift the things balanced way. So when you put pressure on one side, it may lead to back pain. And then you will have to compulsory lose weight, then wear proper shoes, and right sleeping habit is required for reducing a back pain. So for back pain, the asanas I said are Tadasana, Ardha Machendrasana, Vakrasana. Vakrasana I'll show it as Tadasana and Ardha Machendrasana I explained to you earlier. So this is Vakrasana. Okay. Sit down, stretching legs forward on the floor. Keep hands beside thigh, bend right, and keep left leg straight and stretched. Keep the left foot beside the right knee and the left knee raised upward. Inhale and raise the arms shoulder high, keeping the elbows straight. After exhaling, this is fifth step. After exhaling, twist to the left. Place the right arm by the outer side of the left knee. And sixth step, take the left hand behind the back, keeping the palms on the floor. Seventh step, hold on the position as long as comfortable. Eighth position, repeat with other side also. So it helps to increase the elasticity of the spine and tones the spinal nerves. It helps to get relief in stiffness of vertebrae. It helps to reduce belly fat. It strengthens the neck muscle. This asana tones the internal organs of the body. It regulates the secretion of digestive juices, useful for different digestive disorders. And it ensures a balanced hormone level of the body. Contraindication, avoid this asana in case of suffering from sciatica. Avoid practice of this yoga if you have a back injury. This yoga pose should be avoided by pregnant ladies and is not recommended for people having ulcer and hernia. Salabhasana is this. Okay, lying down flat and raising both the arms up, and your hands should go beneath your tummy. Okay, flat, it should be down on your so this is how you do your Salabhasana. Okay, so the benefits are it helps in all the disorders associated with lower end of the spine. It helps in minimizing back pain and sciatic pain. It is useful for reducing unwanted fats around stomach, waist, hip, and thighs. It helps to cure cervical spondylitis and spinal cord ailments. It removes the pressure on sciatic nerve and gives relief from headache and slip disc. It strengthens wrist, hips, thighs, legs, hips, lower abdomen. Mm, What is the timing for vaccination camp?